I would say when I became aware that I was addicted, that I was fully just dependent on these pills.
I would have migraines that lasted for 10, 12 days, and you're just gonna have to accept it, and you're not gonna be able to be the person that you were before.
I wanted to die. I didn't want to live. To go from all that I used to do to I don't have no feeling, I can't move my hand, leg, nothing.
I just felt like nothing was ever gonna help me. You know, this was the end of my life, and I didn't want to be in pain anymore. I didn't even know if I wanted to live anymore. It just wasn't worth it.
The vision was to really look at the problem, at the core problem. If you look at the determinants of somebody's health, the interesting thing is the biggest two factors are actually the socioeconomic environment and the health behaviors. And so if you look at the whole pie chart, the actual delivery of medical care is usually only around about 10%. So if you want to impact somebody's life meaningfully, you have to bring all of those together.
I think it's important to understand the depth and the personal involvement this requires from anybody involved. We understand the role of each individual provider. And this goes from a care coordinator. We're doing individual scrums. We're coming together in one room, spending the time, spending the resources to get presentation on each individual patient every day we see them.
At SAVAS, they've developed this wonderful thing called a Scrum, which is an old rugby term for the little huddle. We huddle before each group of patients that we see. As we sit there as a team with all the members of the team, medical, acupuncture, nursing, we get to hear from each other in that moment, all together, in real time, not only what our impressions are, but what is it the patient's asking from us at this point to reach the goal that they've helped to define. So what we need to do and what we need to help them with is we have to empower them, and hopefully this transdisciplinary model is actually a transformational model, because we're trying to give people their lives back.
SAVAS Health has began this journey to piece together a program that allows the whole person through an integrated system that we call transdisciplinary care, that allows the whole person to be treated.
They made it so easy for us to get the mental care we needed from the amazing staff and therapists.
I never had a massage in my life. So I came here and I let the masseuse give me a massage. That was wonderful. Now I really like them.
Over 1.7 million people in this country today that are suffering from opiate use disorders. These are not just numbers, these are people. This is where the passion began for us.
We've given all providers equal say in the patient's care plan. Everyone is equal in this program, and that's the way it really has to be in order for this to work the right way for the patient. There's no hierarchy of modalities.
What we found when we look at healthcare systems, and in particular the way medical records are done right now, much of the data that we would like to use is hidden from view. So we're trying to develop systems that allow us to get the real data in a format that can be easily consumed so that the words don't get in the way. It's a humanizing technology. It's making the healthcare patient-centered.
We don't just treat the symptoms and spend time. We are consistently and constantly monitoring what is going on with that patient, both mentally and physically, and we're adapting our healthcare practice to them in a real-time approach. We're doing real-time adaptive healthcare that helps reach the patient's best achievable outcome in our program.
But what we found with the SAVAS patent applications is that within a year we had 2 of the 3 patents allowed. As we think about the technology and as we explain it to the examiners at the patent office, they all know, they very quickly realize that that is the missing kind of X factor in how we provide care today.
He had a stroke.
2009?
2008, 2 strokes to the brain.
And back to back.
Back to back, and they really didn't think he was going to be with us 6 months.
So patients that come into our program can really find a home here where we are trying to address all the needs. They can really feel that they come to a place where they have a team that can help them find and follow their path to health.
Well, we met some amazing people here, and Cedric, he's just come a long way. I mean, like, he knew it was time for him to go to his appointment. I can tell he tried to lift himself up when I'm getting him dressed. Oh, he gets so excited.
This program really has helped me. You know, anybody asks me, I'll tell them. It's like I told the guy out there. I was in that wheelchair when I started. And he said he remembered me being in a wheelchair when I started in here.
I looked forward to coming here on my Wednesdays when I was coming. I looked forward to coming here and seeing the group and seeing the people that work here. It's a real nice, happy atmosphere.
We do see patients heal just in almost every aspect of their life, from, being able to get up out of bed. We've seen patients heal mentally by having a lot of anxiety or depression and not leaving their home. And then now they come into the program and they have a group of friends here that they go out to coffee every day now.
Our approach day in, day out is interaction from the medical team, from the behavioral health department. What's interesting is as we go through the program, people do significantly change.
SAVAS and Desert Clinics reduce the cost of hospital days by $250 per member per month. That's substantial.
Dr. Toby said to me, I hope you take advantage of everything we are offering you because this is a gift. And as a result, I blew every goal I had. And I just want to live and I want to share it and I want people to just become present and aware of what they're doing because it all matters.
I challenge anyone. Look into our patients' eyes. I've seen people get out of their wheelchairs and start taking steps. I've seen people get off their couches, collecting disability, looking for jobs through our LCSWs. I've seen miracles happen today.